Hi, I'm Trisha Rotter, and I'm one of the lead physicians at GoHealth Urgent Care in the Oregon and Washington area in the Northwest. And today we're going to be talking about urinary tract infections, otherwise known as UTIs. Urinary tract infection is a bladder infection, so it's when the bacteria gets in the bladder and infects the urine. So really the question that most people have in their mind is, how do I know if I have a urinary tract infection? And this is something the majority of people will get in their lifetime, so it's a good thing to know. In general, most patients experience a feeling of burning and discomfort when they urinate. So just a feeling that something's not right. It might be just a burning sensation or a little bit of sharp pain when they urinate. Another common symptom is feeling urgency and frequency. So feeling like you have to run to the bathroom every 5 minutes. This feeling like I gotta go, but then you get there and there's not much urine, and so you're just going small amounts but frequently. We call that urgency and frequency, and that is one of the telltale signs of having a urinary tract infection. Another common symptom that you can get is blood in your urine. So if you do find that you're getting blood in your urine, you're definitely going to want to see a health professional to get that checked out. Now, older patients and patients with diabetes can experience urinary tract infections differently. So they may not get that initial feeling of burning or discomfort. They may just not be able to feel that or just don't experience those symptoms anymore. So what you might find, especially with elderly patients, is increased confusion. So if you do have an elderly person in your home that is just seeming a little bit off, more confused, maybe sleeping a little bit more, you're going to want to take them in to get checked out right away. Additionally, you might get nausea or start to have a foul odor to the urine, and that's another common symptom. Now, when your urinary tract infection starts to get really bad, so if you have the bladder infection, you don't get it treated, it will continue to progress and get worse without treatment. So what you find in those cases is that it goes from the bladder and then it travels up towards the kidney. So you may start to get flank pain right here, just below the ribs, and it can start on one side and then progress to the other side. You might start vomiting, get very nauseous, and you may start to have a fever. If any of that happens to you, you need to get help right away. So how do we treat a urinary tract infection? Well, the most important thing is that you do need to go in and see a health professional right away, because the treatment for a urinary tract infection is antibiotics. A common myth is that you can treat a urinary tract infection with cranberry juice. Cranberry juice does make the urine a less hospitable place for bacteria to grow, but once you have the infection, it will not treat it. It won't be able to cure it. You can think of cranberry juice as a preventative measure if you're prone to urinary tract infections, but once you have the infection, you need to get help right away to get antibiotics to treat it. Another thing that patients use sometimes is over-the-counter medications. Pyridium is a common one, also sometimes known as Azo or Urostat. And this medication does mask the symptoms of a urinary tract infection. So what it will do is decrease that sensation of burning and discomfort, but it will not treat the infection. We use it after we've prescribed antibiotics to help lessen the uncomfortable symptoms of the urinary tract infection, but it will not cure it on its own. So the most important thing is to come in, get help. It's a very common complaint. We see patients for this all the time in urgent care. They need to come in and get antibiotics. Now, drinking plenty of water is also going to be part of the treatment. And when we think about how do we avoid getting a urinary tract infection in the first place, drinking plenty of water is the mainstay. So you want to make sure that you are emptying your bladder frequently throughout the day, drinking lots of water, and that will help you avoid infections. Another thing that you can do to prevent urinary tract infections is to make sure that you're urinating after sexual intercourse every time. Additionally, when you're in the bathroom, you need to make sure that you're always wiping front to back. That will help avoid infections. So just to recap, our signs and symptoms of urinary tract infections are going to mainly be the burning, discomfort with urination, feeling like you have to go frequently, really feeling an urge, or any blood in your urine. If you're having any of those symptoms, you do need to go in and see a health professional right away. Again, this is a very appropriate complaint to come into an urgent care for, and we are happy to see you at any of our urgent care locations. You can go online and book an appointment at GoHealthUC.com, and we'd be happy to see you.